Insulin, a life-saving hormone, essential for glucose control, but how is it produced, how does it work, and how is it used in therapy? In this video, we will cover everything about insulin and its analog in a simple way. What is insulin? Insulin is a polypeptide hormone composed of two peptide chains which are linked with the help of disulfide bond. It always synthesizes as preproinsulin, which is converted into the proinsulin and finally into insulin and C-peptide, and they both are going to be released from pancreatic beta cell in equal amount. C-peptide is used clinically to measure endogenous insulin production. Now we have to check the mechanism of insulin. Normally, whenever blood glucose level increase, the glucose enters into the beta cell with the help of the transporter known as GLUT2 transporters. Now in the beta cell, glucose metabolism happens and ATP production increases. This ATP close potassium channel and membrane depolarization happens. Now due to depolarization, calcium channel open and they cause exocytosis of insulin. Now we have to talk about the pharmacokinetics. Modern insulin is produced using recombinant DNA technology in microorganisms like bacteria or yeast. When we do some structure modification, it produces different types of insulins and with the different onset and peak and duration. Several factors affect insulin action like dose, injection site, blood supply, temperature, and their physical activity. Because insulin is the peptide, it is destroyed in the GI tract and cannot be given orally. We can give it subcutaneously, IV in emergencies, insulin pumps for continuous deliveries, and inhaled insulin. Insulin pump provide a basal rate and allow bolus dose during meal. Now the adverse effect, the most common and serious adverse effect of insulin is hypoglycemia. Other are weight gain, injection site reactions, and lipodystrophy. Rotating injection site can reduce lipodystrophy. It is important to do dose adjustment in renal impairment. And the second thing, inhaled insulin is not suitable for asthma and smokers. Like, share, and subscribe for more pharmacological videos.